Welcome back, everyone, to the Deep Dive. Today, we are taking a really deep dive into something that's unfortunately very impactful around the world. We're going to be looking at lung cancer.
hmm
And as you probably already know, it's the leading cause of cancer-related death, sadly, all over the world. And we are really interested in one of the key steps in effective treatment, and that's, of course, accurately outlining the tumor, which is particularly important for radiation therapy.
Yeah, that's right. That process is known as tumor contouring, and it's a very delicate and complex process. It really requires a trained eye, especially when you are trying to map out the boundaries of a tumor from medical images, like a CT scan, for instance. And that level of precision is very important because, as you can imagine, you know the radiation needs to be targeted very specifically at the cancer cells while also avoiding any damage to the surrounding healthy tissue.
Right, so this manual outlining, it sounds incredibly difficult and time-consuming, and also requires, like you said, very specialized knowledge. So what happens if that expertise isn't readily available, which I imagine in many parts of the world is often the case?
You're absolutely right. That's one of the major challenges, especially in parts of the world where resources are limited. There just aren't enough trained experts to go around. And what that can lead to is delays in treatment, which obviously nobody wants, and also potentially less accurate radiation delivery. So that's where things get really exciting because that's where the potential of artificial intelligence really comes into play.
That's right. And the research that you've shared with me actually focuses on a very exciting AI solution. Can you tell me a little bit about that?
Yeah, so we've been looking at something called the Oncology Contouring Copilot system, or OCC for short. And this system uses AI, particularly something called language vision models, to help oncologists with that vital task of tumor outlining.
Language vision models, I mean, that sounds pretty cutting edge. So I think our mission today is to really understand how this OCC system actually uses AI to improve the accuracy and efficiency of lung cancer treatment planning. And a key part of that, I think, is understanding how it deals with the problem of false positives in detecting these tumors.
Absolutely. You know, AI has shown huge promise in identifying tumors on CT scans, but one of the main issues has been this high rate of false positives. In other words, the AI flags something that it thinks might be a tumor, but it turns out it's not. So the sources we've been looking at really dive into how OCC tries to solve that problem.
So let's talk about that problem of false positives. I mean, what are some of the things that can actually cause these AI systems to get it wrong?
It's interesting because there are actually quite a few things that can resemble a tumor on a CT scan. Things like pulmonary blood vessels, the edges of the lungs themselves, even just noise or artifacts that show up on a CT image can all be mistaken by a traditional AI algorithm as a tumor.
That makes sense. It's almost like trying to find like a specific pebble on a beach full of pebbles. And I can imagine that just relying on what the AI sees in the images must have its limitations, right?
Definitely. Traditional AI methods, a lot of times they only focus on that visual information from the image. They don't take into account the bigger clinical picture that a doctor would have. And that's an important missing piece of the puzzle because, doctors, they gather so much information about their patients through things like medical history, physical exams, all sorts of other tests. And all of that information is usually stored in something called electronic health records, or EHRs.
Okay. So how does this OCC system go beyond just looking at the pictures? How does it actually bring in that important clinical context?
That's where these language vision models come in, and it's actually really fascinating. So you've got these models like GPT-4V and Claude 3, and these are AI systems that can process both images and text. And the OCC system uses that dual ability very cleverly.
So it's not just seeing the scan, it's also kind of reading the patient's medical information.
You got it. And the way OCC works is it involves a couple of key steps. So first, it uses a model called Retina UNet 3D. You can think of it like a superpowered image scanner, and its job is to go through those CT images and find anything that looks suspicious, anything that could be a potential tumor nodule.
Okay, so that's kind of like the initial screening, right?
Yeah.
Flagging anything that's a potential concern. And then the next step, the real key here, is to filter out those false alarms.
Exactly. So once those potential candidates have been identified, the OCC system uses those language vision models to analyze both the visual data, so that's the actual images of the potential nodule, and the textual data, which is the clinical descriptions from the patient's electronic health records.
So the AI is actually reading the doctor's notes and then comparing that information to what it sees in the scan.
That's exactly right. So by understanding that clinical context, things like, past medical history, other findings on the scans, even the radiologist's initial interpretation, the language vision model can make a much more informed decision about whether or not a flagged nodule is actually a tumor or just one of those false positives. It's like having the knowledge of an experienced oncologist built into the AI decision-making.
Right. And, figure one in the paper actually lays this out quite nicely. It shows how it goes from those initial diagnostic tests through to expert review and then finally to this automated contouring. It's really a nice visual representation of this collaboration between human expertise and AI.
It is. It really emphasizes that this isn't about replacing doctors at all. It's about making them more efficient and helping them be more accurate.
So let's get into the specifics of how this actually works step by step. What are the steps involved in this combined image and text analysis for each potential tumor?
So after that initial detection phase, OCC picks out a slice from the CT scan, one that clearly shows the potential nodule. And it also includes the outlines of the lungs, those lung masks that are generated by the computer. And this image along with the clinical description from the patient's EHR, is then fed into the language vision model, like GPT-4v.
Okay, so it's taking in both the visual and written information at the same time. And then what does the LVM do with that data to actually identify the real tumors?
So the LVM analyzes the image, it pinpoints the exact location of any potential nodules, and then it cross-references that with the clinical diagnoses and the findings that are in that EHR text. And what it produces is a report that aims to cut down those initial false positives significantly. So it's doing a much more sophisticated analysis, much more context-aware than if it was just looking at the image alone.
And figure 2 in the paper actually does a great job of breaking down the different components of this OCC model. And it highlights the LVM as that key part that's responsible for reducing those false alarms.
Right. So the initial model, it's like it casts a wide net, and then the LVM acts as a really intelligent filter. It uses those clues from both the image and the text to refine the results.
Now the question everyone's thinking, I'm sure, does this actually work? What kind of improvements did the OCC system achieve when it comes to, identifying those real tumors and getting rid of the false alarms?
The results are really impressive. They found a 35% reduction in the false discovery rate. And just so everyone's clear, the false discovery rate basically tells us how many of the things that the AI thinks are tumors actually turn out to be nothing. So a lower FDR means fewer false alarms. And then on top of that, they also saw a 72.4% decrease in the average number of false positives per scan.
Wow, that is a huge improvement. I mean, fewer false alarms must be a huge relief for patients. It means less worry, less need for potentially unnecessary follow-up tests, and just a more direct path to the right treatment.
Absolutely. And they also calculated something called an F1 score, which was 0.652, which shows that it's doing a good job of balancing precision, so making sure it doesn't incorrectly identify things as tumors, but also recall making sure it doesn't miss any actual tumors. And what's really interesting is that this OCC system, using those advanced LVMs like Claude 3 Sonnet and GPT-4v, it actually consistently outperformed other methods like UNAT-3D, which only rely on the visual data.
And Table 1 in the paper actually lays out those different methods for you. It compares them all side by side, and you can see the ones that use the language vision models do much better across all those different metrics. It really highlights the value of that added language understanding.
It really does. It shows that just focusing on the images isn't enough. You need that extra layer of information from the text to really improve accuracy.
So I can imagine that just throwing an image and a medical record at a language model isn't going to magically solve the problem. The paper mentions something called prompt engineering. Can you explain what that is and why it's so important?
You're absolutely right. To get the most out of these language vision models, you need to guide them very carefully. That's where prompt engineering comes in. It's basically about creating the right instructions and providing the AI model with the right context through the language you use.
So it's about asking the AI very specific and clear questions so that you get the best possible answers.
Exactly. And the researchers tested a bunch of different methods for creating these prompts, and they actually found that using a single image that had all the important information together, like the nodule and the outlines of the lungs, actually worked better than giving the model multiple images of the same area.
Oh, that's interesting. I would have thought multiple images would be better. More data.
Yeah.
Why do you think that is?
Well, they think it's because it simplifies things for the model. It can just focus on the relationships between all the different elements in that single image. It doesn't have to try and piece together information from multiple different perspectives. Another key thing they found was giving the model enough time to think. They didn't put strict limits on how long the prompt could be, and that extra processing time meant that the AI could reason through things more carefully and accurately.
That makes sense. You wouldn't want to rush it to a conclusion without letting it process everything. What are some of the other techniques they found that worked well?
So another really interesting finding was that rephrasing medical prompts in more everyday language actually helped to avoid the AI giving those kind of standard medical responses. They called it concealing medical intent, and it seemed to encourage the AI to really analyze the specific details of that image and text without relying too much on its general medical knowledge. And they also used a series of guiding questions, breaking down the problem into smaller steps to help the AI reason more logically and find those subtle differences.
It's like you are guiding it through the thought process, step by step. Almost like a human expert would.
Exactly. And then they experimented with adding what they called vision instructions, like embedding colors into the images, which actually improved the AI's ability to recognize those colors and highlighting areas of interest. So things like cropping out the unnecessary background and adjusting the contrast of the image, which help the AI see those small nodules that can be hard to spot.
I love that figure 3 in the paper because it shows some of these techniques visually. It's really fascinating to see how these small changes in how you communicate with the AI can make such a difference.
And Table 2 really hammers that point home because it shows the results of their ablation study, where they removed each of those prompt engineering elements one by one. And when they did that, they saw a clear drop in performance every time. So for example, without that single vision input, the model couldn't compare things as well. Without enough time to think, it made more rushed judgments. Without that concealed medical intent, it missed more false positives. Every little tweak had a big impact on how well it worked.
That's so interesting. It's really like a combination of art and science working with these AI models. It's not enough to just have the technology. You need to know how to talk to it.
Precisely. And to really show the potential of this approach, the researchers included a couple of case studies that are really insightful.
Oh, tell me about those. What do they show about the AI's ability to identify tumors and rule out false alarms in real-life situations?
So the first one was a really tricky case. It involved a very small tumor nodule, but it was a real tumor. And GPT-4V was able to correctly identify it, even providing a detailed explanation for its reasoning. But another model, Claude 3 Sonnet, didn't give any response at all. And a different model, called VLT, actually misclassified it as a false positive.
So in that case, GPT-4V was the only one that was able to catch it, which is pretty impressive. What about the other case study?
So that one focused on a nodule that was a bit bigger, but it turned out to be a false positive. And both GPT-4V and Claude 3 Sonnet got that one right, clearly explaining why it wasn't a real tumor. VLT, again, got it wrong and said it was tumor when it wasn't.
These case studies are great because they really illustrate those statistical results. It's one thing to see the numbers, but it's another to see how it plays out in real-world situations. And you can actually see those case studies in Figure 4 of the paper.
Exactly. And I think it really emphasizes the potential of these language vision models, especially GPT-4V in these examples, to both reduce those false positives and accurately identify true positives.
So this all sounds incredibly promising. But as with any new technology, there are always limitations. What did the researchers point out as areas that need more research?
Well, they were very upfront about the limitations. One thing they acknowledged was that they mainly tested their methods using data from their own institution. So they highlighted that it needs to be tested on larger and more diverse data sets from different hospitals to make sure that it works reliably for all different types of patients.
That makes sense. You don't want it to be biased towards a certain population or a certain type of scan.
Right. Another challenge they pointed out was the difficulty of getting really detailed feedback from top experts on a large scale. Having those experts review the AI's output takes a lot of time and resources.
Which is understandable because it's such a critical task and it requires a lot of expertise.
Another important point they raised is that even though they saw significant improvements, that false discovery rate, although lower, is still at 0.511. And the 3D DIC score, which measures how well the AI's outline matches the expert's outline, is 0.4164. So that suggests that there's still room for improvement before it's ready for prime time in every situation.
So it's a big step forward, but it's still a work in progress.
Exactly. And they explained that one of the reasons for this is that the initial model that detects the potential tumors is designed to be very sensitive so it doesn't miss anything, even if that means flagging a lot of things that might not actually be tumors. And then the false positive reduction step tries to filter out those less likely candidates.
It's that classic dilemma in medicine. You don't want to miss anything, but you also don't want to create too many false alarms.
Exactly. They also mentioned that their current method is better at dealing with false positives that are in different parts of the lung. When they are in the same lobe, it gets a bit trickier.
That's understandable. It's probably much harder to tell the difference when they're right next to each other.
Right. And they suggested some areas for future research, like incorporating even more textual information, things like the size and stage of confirmed tumors, and also looking into other types of errors that language vision models can make, not just those related to detecting small objects.
So there's still a lot to explore,
Yeah.
but it's really exciting to see this progress being made.
Absolutely. And I think even with those limitations, this OCC system represents a major advancement in tumor contouring for lung cancer.
Yeah.
It's combining the power of language vision models with the knowledge of medical experts, and that's really promising.
Definitely. And for our listeners out there, it's clear that this kind of approach has the potential to make a real difference in lung cancer treatment, streamlining those complex workflows, reducing those false positives, and ultimately improving outcomes for patients.
It does. And I think it raises a lot of interesting questions about the future of AI in medicine. What other applications are out there? How will these technologies continue to evolve and improve? It's definitely something to keep an eye on.
It certainly is. Well, thank you so much for taking us on this deep dive today. It's been fascinating.
My pleasure. Thanks for having me.
And for our listeners, we'll be back next week with another deep dive into a cutting-edge topic in health and medicine. Until then, stay curious.